Hi, I'm Dr. Rashmi Yogish, consultant fertility expert at Khushi Fertility and IVF Center, Bangalore. What do we do if the womb lining is thin? We get to see a lot of women who have thin endometrial layer, and this becomes a major obstacle for pregnancy. Especially when drugs like clomifene citrate are used, there is a possibility of the endometrial lining getting thinned out, and this is only due to the drugs. But in women who have had tuberculosis of the uterus, there is a possibility that the uterus lining can get thinned out. And then there has to be something called as rejuvenation of this endometrial lining with procedures like hysteroscopic freshening of the endometrial layer, intrauterine subendometrial PRP procedures, platelet-rich plasma procedures, or intrauterine or a subendometrial injection of stem cells. Most of these are proven to be effective in the treatment of thin endometrium, and in our experience, we have had success in all of these. Some women can have thinning of the endometrium because of previous uterine surgeries, especially when fibroids have to be removed, and the fibroids that have projected into the uterine cavity. During the removal of such fibroids, there is a chance that the endometrial layer can get affected and then can get thinned out. Sometimes we see that the endometrial layer is thinned out after a procedure called curettage of the uterine cavity, which is done especially after an abortion. Repeated miscarriages, repeated uterine curettages invariably results in thinning of the endometrial layer, and then there's a challenge posed towards getting pregnant. However, with the recent advances in the therapies that I spoke about, that is the platelet-rich plasma therapy, stem cell therapy, and hysteroscopic rejuvenation procedures, uterine freshening, adhesiolysis, there is a lot of hope that the endometrial layer can be rejuvenated again. So one should not lose hope if the endometrial layer is thin and resort to things that can help them out, as we have seen a lot of successes with these procedures.